medicine. Oh, okay. Sorry, something came up. So dentistry is pretty special in terms of you can graduate as a general dentist and you can decide what procedures you do. You can take different courses, different continuing education courses to learn how to do veneers, how to learn how to do implants, learn how to do Invisalign, learn how to do basically whatever you want to do. Physician is not like that. Physician, you need to go to residency, and then you specialize in that specific, let's say, surgery or whatever procedure you're going to do or whatever part of the body you're going to specialize in. So that kind of makes it pretty special. There's different specialties in dentistry. Oral surgery is wisdom teeth, periodontics is gum and bone, endodontics is root canals, orthodontics is braces and Invisalign, pedodontics is kids dentistry, prosthodontics is crown and bridge. And there's even residency after dental school, which basically makes you, let's say, quote unquote, a super dentist, a super general dentist. You get a little more specialized procedures and learn about that. So, there's oral surgery usually takes about 6 years, and you also get your MD. They're the most overqualified tooth pullers you'll ever run into. That's kind of the joke that the oral surgery resident always would say, is that you're going to 6 years of medical school, but you're learning how to do, even, let's say, God forbid, you're in a car accident and someone has to reconstruct your face. It's actually an oral surgeon, oral maxillofacial surgeon, that does that surgery, and then the cosmetic surgeon comes in and makes you look pretty. So, but a lot of oral surgeons, their bread and butter is taking out wisdom teeth, because, in 15 minutes, you can rip out 4 wisdom teeth and go on to the next patient. First, if you're doing a big case, you have pre-op, post-op, you have the actual surgery. So it's a lot more difficult, and it's not as much of a money maker. Periodontics, endodontics, orthodontics, about 3 years, even pedodontics and prosthodontics, about 3 years after dental school. So dental school is usually 4 years. I think UOP is the only program, University of Pacific, that has a 3-year DDS program. So you can also be a consultant. I actually just hired one for my office that's a dentist. So let's say you become a clinician, you get bored of doing dentistry, or you get tired of doing dentistry because it's rough on your body, and you can be a consultant. You can go into other offices and share your wisdom. So that's kind of nice too. You can be a practice broker. So there's just a lot of practices up for sale in dentistry, and it's usually dentists, and usually they go get maybe even their JD, their attorney license to broker these deals. You can be an educator. So like I said, dentistry is different because you can, like, I can start a course. Let's say I want to teach implants. I can start an institute. I can send marketing to other dentists, have them come in and teach them how to do implants. So that's kind of unique too, is that you don't need, let's say, the backing of a dental supply company to do that. There are dentists that open dental supply companies. They maybe produce or get a patent for their own little device that can help dentists every day in terms of whatever procedure they're doing. The biggest example is probably Implant Direct. Was started by a dentist, and he basically made his own line of implants and sold for millions and millions and millions of dollars. You can even open a dental lab. A lot of dentists will even open a dental lab. They keep everything in-house. So there's a lot of different routes to go, and that's not even all of them. So I'll kind of go into UCI, then dental school, and then my path working as an associate, and then enamel. That's the name of my office. So my path at UCI, I was a bio major. Probably all of you are bio majors. My upper classes, I took environmental sciences. A lot of them, I was trying to be smart and boost my GPA and take the easy way out and enjoy my 3rd and 4th year, which probably wasn't the best idea, because 1st and 2nd year of dental school, I got my butt kicked. So it would have been nice to take microbiome, physio, all that. I took my DAT my third year and I applied my third year. So fourth year, I knew where I was going. I applied to 10 schools, and I kind of just picked them out of the blue. I didn't really know what I was doing. I don't know, I kind of just picked some. And I picked all of the 5 California schools. I don't know if there's 6 now in California. Maybe Pomona, I think, has one. Um, and then I applied to Nova, Las Vegas, um, Columbia, no, not Columbia, New York, Boston, and somewhere else I can't remember. But I got into Boston. I don't know if you guys know about Student Doctor Network. That was a good resource. It's online, Student Doctor Network, and it kind of tells you what other students write, what the interview questions were for those schools. So that was very useful, because then you can go look and be like, what's the school's like interview process? Is it difficult? What are they going to ask me? And then you can kind of prepare. I lucked out because my aunt went to a dental school with somebody that was on the was working at BU. I can't remember where. I think in the outreach program, and then he kind of coached me. I met with him. He kind of coached me with what to say, which was nice. And like points and research and things to bring up. He kind of gave me some articles, which helped a lot. I feel like in the interview, I was able to really talk about outreach and this kind of stuff that I wouldn't have really talked about or known about if it wasn't for him. So I was accepted into Boston University, fourth year. I was a part-time student. I was just finishing up. Things I could have done differently. There's one of you that is interning at my office now, or shadowing at my office now. I don't know if she's in here. Maybe she is, maybe she isn't. But she's thinking about taking a gap year. To that, I would say if you want to take a gap year, take a gap year. It might delay you, and I kind of ran a sprint to get to dental school and to graduate and start working, and I haven't really stopped working since then. So maybe it would have been nice to take a gap year and enjoy or do something different for a little bit. In a gap year, I guess you can be productive. I wish I had learned more about business, more about marketing, more about sales. Dental school prepares you really well for basic dentistry and becoming a dentist. It does not really prepare you. There's Kylie. It doesn't really prepare you for, let's say, opening a practice and all the other things that come with it. So if a gap year could help you kind of get these other skills under your belt, depending on what you want to do when you get out, it's kind of a great thing to do. Or take a gap year and go travel and do what you want to do. And because when you graduate dental school, you're going to have bills and you're going to have to start working. So if you have the time, do it. If you can get out and, I don't know, travel the world, go sail around the world, do it. One thing I wish I did, well, I don't know if I wish I did it or not, but there are lots of, well, I don't know about if there are lots of scholarships, but I wish I had applied for scholarships. Dental school is very expensive. If you're paying for it on your own, the loans are tremendous. This is not to deter you from going to dental school, but I kind of just want to put that out there for you guys too, because I didn't understand the gravity of the amount of loans that I would take out to go to dental school, and the implications of paying them back. Armed forces. So for dental school, you can join Army, Navy, Air Force, and what's the other one? Marines? I'm not sure. Coast Guard? Something. So basically what that means is that they pay for your 4 years of schooling. And then when you graduate, you have to pay it back in terms of your time. You go get stationed on a base somewhere. You're not in the front lines. You graduate as an officer. they invested so much money into you that they're not going to let you go on the front lines. You go do dentistry in a clinic somewhere. One of my buddies got stationed in Oklahoma. Another one got really lucky, got stationed in Camp Pendleton, which is in San Diego, like halfway between here and San Diego. Another one, I think, got stationed where else? Nebraska. So you're kind of just doing dental work, but the first 4 years I was just working for someone and getting practice anyway. So the reason why I say that it's a good deal is because you would be done with your loans in 4 years. And usually people don't open a practice. Usually you're working for someone the first 4 years anyway. So I know we're all Armenian and we're all rushing back to our families in LA. So some of you dreading it more than others, but I don't know. It would have been a good thing to explore that. The other thing, even in your gap year, you could shadow at a general practice, or even now, shadow at a general practice, shadow a specialty practice. These are important things because you're about to take out, $600,000 loan, or if your parents are paying for it, awesome, that's even better. But you're going to get locked into something. You're going to spend a lot of time. You're going to invest 4 years of your 20s, which is probably the best years of your life, to something like dentistry. And if you got to know that you want to do it, you got to know that you want to, to be a dentist. So I would say shadow, general practice, specialty practice. That was my doom and gloom part of the presentation. Maybe we'll go back to it. Boston University Dental School. So first and second year of dental school is more didactic. You do some labs before you do clinic. So the labs are like little dummies. You drill on dummies. You do like fillings on the dummies and whatever. But first and second year is you're doing classes with medical students, or like the same level of classes as medical students. You're doing physio, anatomy, you're dissecting bodies. So dead bodies, you get to take apart if you think that's cool or not. You'll be in there. So that's when I wish I took more physio and anatomy in my upper division classes, because that was super difficult, is because I'd never taken anatomy or microbiome or anything like that. So I kind of wish I did. Third and fourth year, you have significantly less didactic and you see more patients. So that's nice, because for me, I was always better with my hands than I was at bio. I was really good at like OChem. I was really good at physics. I wasn't good at memorizing, like how bio was more memorizing. I was better at reasoning through things. So that was a lot easier for me, and that's kind of where I excelled. So, every dental school is different than medical school, because you're going to be seeing patients and you got to be good with your hands. If you're not good with your hands, you're going to have a really tough time. And you're not going to be too happy. I mean, I had classmates that were not good with their hands, and I think they still hate practicing. So that's kind of something to think about too, if you're thinking about going down that road. I graduated cum laude, and it was definitely a special moment. I was going to pull up the photo, and I didn't have time to pull it up. So it was, my aunt handed me the diploma as legacy. So that was super cool, rather than the dean or a faculty. So that was kind of special. Dental school is kind of interesting because you, like UCI, your professors, they're older, and, they see them as professors and teachers, and you're not really colleagues. When you get to the dental school level, it's kind of special, because there are professors that are, in their 20s, in their early 30s, so they're your age, and you become friends with them because you're going to become colleagues with them when you graduate soon enough, and they kind of understand that. And so you go out with them and you hang out and you form bonds with them. So dental school's kind of special in that way. Anyway, so for picking a dental school, so I chose Boston. It's definitely an urban area. That's one thing you guys will have to figure out when you're applying. is, do you pick a more rural or more urban? Usually, if the dental school's like out, in the sticks, you'll be doing a lot more clinical work. So you get to have more patients, see more patients, because there just isn't as much specialty around you. Because number one, we'd have patients, let's say it was a molar root canal, like, so one of your molars did the root canal, those are harder. We'd have to kick it up to the endo program at BU. So all the endo residents, all the root canal specialists, soon to be, had to do all those. So they didn't really let us do that. So I didn't get a lot of experience doing molar root canals. Versus I've had friends that are like that went to dental school out in rural areas, and they couldn't keep up with the amount of patients that they had, because especially in Boston, you have Yale, Tufts, and BU. I'm not Harvard, Tufts, and BU, not Yale. So you have 3 dental schools, and then you're in a city, so you have a bunch of Medicaid clinics. Usually the patients that are going to these clinics are Medicaid patients, lower income levels. So you're splitting patients between the dental schools and the Medicaid practices, so you don't get a lot of patients. Our requirements to graduate were pretty low in terms of how many extractions we had to do. Like we never got to place any implants. We didn't do any molar root canals. We didn't do any surgical extractions, which surgical extraction is removing bone to get the tooth out if it's decayed badly enough. So in terms of that, I think BU prepared me very well for theory, didactic. So I knew what was going on, but we didn't get prepared very well in terms of more complicated procedures. But at the same time, you're just learning dentistry, and probably the more complicated stuff you're not going to really understand much anyway until you start getting your hands wet. So that's something to consider is, could you live in a rural area for 4 years? And we're used to LA and OC, and there's everything, and it's a big bustling area. So I don't know, could you do that? I think that those schools, you'd see more patients, so that's nice. And that even applies in terms of income when you graduate. When there's less people to dentist ratio, you can make more money in rural areas. Usually, doctors are affluent people that want to be in affluent areas. So there's just more of us in affluent areas. So you're splitting patients more. Cost of attendance, super important. Something to think about, especially if you are paying for it and your parents aren't paying for it. You're going to take out loans. My friend from dental school actually just sent me the cost of BU is, I think, about $140,000 a year. So by the time you get out of school, you're going to be, I think, over $600,000 in debt. So that's something to consider. When you're applying to schools, learn what tuition is, what cost of living is. They'll tell you what the maximum approved loan is. So I think tuition was like 90,000, and cost of living, like basically they give you another however much for books and living and rent and all that. And then, do you want to specialize? So if you're going to a school if you want to specialize and they don't have a lot of specialties, or the specialty you're looking for, or very limited spots, maybe that's not a school you want to go to. So these are all things to consider when choosing a dental school. Dental school is a good experience for me. It was good. And then when I graduated, I moved back to LA. My first job was for my aunt. She called it a mini residency. So basically there's residency after dental school. If you choose to do it, you kind of take a pay cut, but you're still kind of like in your 5th year of dental school, where you have a preceptor, you and some residencies are great and some residencies aren't. I remember some friends that went and they were cleans and fillings in their residency, which is basic stuff. But if you're going to do residency and take a pay cut, then I would expect to learn more complicated things like wisdom teeth extraction, implants, things like that, to really make it worth my while. My aunt's office is in downtown LA. It's by Langer's, so low socioeconomic area, high volume practice. I think I would see maybe like 30 patients a day. It was pretty wild, especially when you're getting out fresh from school. Uh, 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 school, uh, so, for care, you know, specifically, and how that's how and after, there was um, 6 different offices I worked for. Um, and then you also learn there on how you get taken advantage of and how managers kind of will kind of bully you around to do things that you don't want to do. But it's a good experience because then you know the more business side of things, which in dental school you don't learn at all. So learning the business side it's very important too. Um, both these jobs were high volume. They weren't really high socioeconomic offices. Um, so I kind of got more feel of high volume. But that was great because I got a lot of clinical experience. I mean, I did way more root canals, way more extractions, way more crowns, way more fillings than the average person. I was working maybe 6 days a week because I was uh, covering my aunt's office because she had torn her Achilles. So I was working 6 days a week. I came to a point where I was deciding, do I want to stay in California or go to Texas? I had a buddy that graduated from UOP. I went to UCI with him. He went to Texas because his cousin had an office there. They were doing Medicaid pedo office, so basically all kids, because Texas's insurance pays crazy good. So they were making, I don't know, hand over fist. It was nuts. So I was coming to a point where, am I going to stay in California or am I going to go to Texas and just make a lot more money? I had another friend that I went to dental school with. He had opened in La Jolla. This guy was a different animal because he was taking higher level courses in dental school, like elsewhere. Um, so I got licensed in Texas. I was going to go, and then I kind of decided last second, talking to family, that to open in California. So I started taking a lot of courses, and just, other than dental school, there's more money to take these courses. I learned about conscious sedation. I learned veneers through the cosmetic courses, how to design a smile, which is super important. I took implant courses. I took full mouth reconstruction courses. So all important skills to have if I wanted to open, practice in Newport Beach. I started the practice it took me about a year to open it. But every dentist I talked to that I would tell them I'm going to start a practice in Newport Beach kind of thought I was crazy. Because it's just a very competitive market, but that's kind of what I wanted to do. I did the high volume thing. I did the low socioeconomic thing. I wanted to be friends with my patients. I wanted to establish real care. I wanted the patients that, that come every 6 months that we develop. It wasn't just like someone comes in, you drill, fill, do some extractions, and then you don't see them again. So it was a different model that I wanted to do. My friend at Bank of America, he was my friend from UCI, fraternity brother. He was in Bank of America, and he just kind of one day was like, actually not one day, it was probably for 6 months. He would pester me to take the money and start opening because he would see me in Southgate. I was working in Southgate, and he didn't want to drive anymore. So I think it was little selfish reasons, but that was great because he pushed me to take the loan to get the real estate broker to get the lease, to contact my to contact an attorney to review the lease, to get a contractor, to contact the dental supply company to come up with a design. So it all kind of snowballs once people know that, hey, I want to open, and then they put you in touch with their vendors and their contacts, and then it kind of snowballs with all the different people you need to open a practice. So it took about 1 year to open. That was a pretty crazy time because it was very stressful. Opening a practice from scratch, you don't have a patient base. Versus if you buy an office, that's also very stressful because you are taking over someone else's office and you don't know what their style was, what their patients are accustomed to. But there's also cash flow already. There's also money coming in because there's all an established base, a patient base. But I had to learn. I thought I knew from my associate jobs on how to hire staff, how to work with insurance companies, how to work with marketing companies, how to work with billing companies, all that. So that was another eye opener to learn all that. But you kind of just do it. You're in that situation and you learn on the fly. And I don't think you really know things until you have to know them. So Enamel General and Cosmetic Dentistry, it's the name of my office. It's been about 8 years since I started my practice. I'm still the only dentist there, but my goal is to hire an associate next year. My goal is to also hire more hygienists, just to grow. It's been a slower curve, but I think it's because I've been doing it the way I want to do it, and I haven't been doing it in terms of taking on a lot of patients in high volume. So I've kind of wanted to keep my model as doing good dentistry, caring for people. So growing slowly. And dentistry is special because I open my office and I do things the way I want to do them, and I make my hours the way I want to make them. So that's special versus if you're gonna do a different part of healthcare. If you're going to be kind of sucked into the corporate side of things, you're not going to be doing it the way you want. I don't know. With AI, probably dentistry is the last to go, I would think. Even if they perfect the hardware, even if they perfect the robots to do it, I don't know how many people will have faith in a robot drilling on their head. So yeah, dentistry is very interesting. Like in terms of pharmacy, let's say pharmacy is getting swallowed up by CVS and Rite Aid and and Walgreens. So it's difficult to open a private pharmacy. I would say more difficult than in terms of dentistry. The other crazy thing about dentistry is that the bank will give you the money 100% finance. So you put no money down and they give you working capital. There's not really any other business that the bank will just give you the money and say, we know you're good for it. So dentistry is profitable. Dentistry is great. Dentistry is stable. You'll always have a roof over your head. You'll always be able to afford the basic things in terms of getting really rich. If that's your goal, dentistry can provide that, but you got to go through the business side of dentistry to get to a point like that. So I'll show you some before and afters. This is Invisalign. And I think we did a little bit of composite bonding for him. So we just kind of broadened his smile, and then we just pulled the lateral incisors down, and a lot more even, a lot more harmonious. She was an Invisalign case. We cut her gums to fill her smile space. We did some beautiful veneers. So I like doing veneers that are more natural, that people don't know if they're veneers or not. But I have some patients that ask for that, so I can always provide that. I think the important thing about doing cosmetics, which took me a while to understand, is that you have to listen to the patient and what they want, you got to deliver. So if you deliver what you want, there are times you're not going to get a happy patient because, beauty is in the eye of the beholder. So it's their mouth and you kind of have to figure out and have that vision to deliver that. Um, so here's another patient. She was grinding her teeth all her life, not wearing a night guard, just broken crowns, bridges. Um, this was a full mouth rehabilitation. We basically made her teeth longer, top and bottom. Um, so this is the more rewarding stuff I like to do is, full mouth cases. Um, and when you learn the first step is learning how to design a smile. You learn how to design a smile, and then um, you can deliver that with the right lab, with the right planning. So, um, like I said at the beginning, people's confidence changes. People all of a sudden that were almost in tears when they're coming to you because they're so scared and they hate the dentist so much, all of a sudden start loving you and they start smiling. And then you have their family members that come in for cleanings and they tell you like, oh my God, she's so different now. And she's smiling all the time and like her whole aura has changed. So, dentistry is very powerful. It's very rewarding. It's a blessing to be able to provide services like this. This one is more missing both. So, what? I said it before, volunteer at a general practice, but volunteer at a specialty practice, see if you really like it. Usually you get out of dental school and you don't really go straight to consulting or this or that, or educating or working for an insurance company or that kind of stuff. Usually you start by being a clinician. Life that you want. Imagine, do you want a family? Do you want dentistry is usually I'm there in the office every day. Do you want to work remotely? Do you want to work remotely? Usually doesn't work with dentistry. Do you want to travel? I don't know, or live abroad, or there's a lot of questions. And I mean, I even put what kind of cars do you want to drive? Where do you want to live? What kind of house do you want to live in? I mean, these are important questions. I think where we think about think that oh, money will always come, or don't think about money, think about money is a bad thing, but something you guys should think about. What kind of life do you want to set up, and then reverse engineer it, because you have to be happy in what you're doing at work, and you have to make enough money doing it. It's two very important things, because you can't just love what you do and not make money, and you can't make a lot of money and hate what you do. They can't be mutually exclusive. So that's kind of my wisdom for you guys is you got to choose something that you're going to be happy with and you're going to be well compensated with, and try to start thinking about what lifestyle do you want? Do you want what you grew up with? What does that life cost? um Even with the dental school thing, even with the cost of loans, that's another thing. I mean, I never really thought about budgeting and this and that, but think about even do a little exercise for yourselves. Write down how much money you spend every month what's your rent, what's your car payment, what's your insurance. It's a good little exercise. It's kind of depressing, but it's a good little exercise to know. And that information can help you kind of reverse engineer too. I think that is all, and I think we are going to open it up to questions.
Great. Thank you so much for that detailed and long presentation. I'm sure everyone learned a lot, and I know I did. So I think we can, yeah, go ahead and open it up. If you guys have any questions for Dr. Kabaklian, please, you can raise your hand or type them in the chat. We'll just like reserve the end of the meeting for that. Thank you so much again. Very informative.
No problem. And I mean, I see one question. I'll get to it. Yeah, if you guys think of anything too, I can always share my email address. I don't think I shared it, but or even my phone number. I don't mind if you guys text me either. So I chose dental over med. It's kind of a funny response, but all the physicians I talked to, all the family friends that were physicians, didn't seem very happy. Versus the dentists seemed a lot happier. So this might be a bad way to choose something, but I don't think I was very methodical in my path in life. I feel like I just fell into things and rode the wave, and that's why I kind of was like, things I wish I did differently, or action steps, or figuring it out. So that's why. Medicine also, depending on what you want to do, I feel that I could be wrong. You guys can tell me that I'm wrong, but I feel like medicine is going to be a really long road. So you can do 4 years of medical school, and then you're going to do you might be a general practice family practitioner, which in my opinion, that is just someone comes in, you refer out, refer. You're not doing a lot of stuff in medicine. First, dental, I'm a general dentist, but I do a lot of stuff. And then if I wanted to do, let's say, surgery, or if I wanted to do cardiology surgery, or every step, every layer, you're in school longer. So I think that if you go into medicine, you have to be prepared to be in school for a very long time, and that's not something I wanted to do. I had this urge at UCI or in my 20s that I wanted to get out, go straight to dental school, graduate, start working, like make money, and I don't know if that was the right decision, but that's what I did. But yeah. And I think medicine, you'll do residency 4 years, fellowship 2 years, and then you can even do like even something more. So you're gonna be in like medical school for about 10 years.
I had a question, actually. I'm not sure if you covered this in the presentation, but I was wondering what made you, or like what drew you to Boston? You went for where you went for dental school. Why were you drawn to move out there?
I got into NYU, I got into BU, I got waitlisted at USC, and then I got accepted to USC. But USC was problem-based PBL, problem-based learning. So it was problem-based learning wasn't going to be good for me, because it was like you have to go do the research, and then you have a group, and then you have the professor, and you get a subject. You guys got to go research the subject and figure it out, and then you go back to the professor and say like, oh, this is what we came up with, and you can be like, nope, you're wrong, go back to the drawing board. And for me, I didn't think I was going to thrive in that. I wanted the traditional school system, that they're going to give me the PowerPoints, they're going to tell me what to study, they're going to tell me what's pertinent. So that's why I didn't want to go to USC. I got into BU. My aunt went to BU, so she always was speaking very highly of it. So my aunt was kind of my mentor, And then NYU, I heard, I don't know if it's still like this, but they cut the bottom third of their class because their class size is like over 200 people, which is big for a dental school. I think it's the biggest dental school in the US. So they cut the bottom third, and I think you have to redo it, which redo first year, which I wasn't going to do that. It's kind of different. Dental school is kind of different because they are really invested in you. At least BU is because they want you to keep going. They want you to keep paying tuition, and they don't want you to drop out. And it's that whole colleague thing, you know, like it's not like UCI where you kind of get lost. It's like bio, how many people are in your classroom is 400. So it's a lot smaller, dental school in general. So they want you to succeed. Yeah. So that's why I chose Boston. But also, I just wanted to go talk shit on the Celtics. Just kidding. Sorry. But okay, and then what fraternity did I join in dental school? It wasn't dental school. I was in Kappa Sig at UCI. I don't know if they're still good or not, but that was a great experience too. I would definitely recommend. Did I ever want to specialize? I didn't. I kind of just wanted to get out and start working, and I thought dentistry was unique because you can, you know, do whatever procedure you want. I didn't want to spend more time in school. I wanted to get out of school. How do you prepare for DAT during third year UCI? So see, long time ago. I don't know. No, I'm kidding. I did use DAT boot camp. I think I used Kaplan. I did really well in OChem. I did really well in GChem. I think I got like 17th percentile in reading comprehension, and I didn't want to take it again. And I went on my interview, and I remember the interviewer asked me, like, oh, you did really great. You're in like 90th and over percentile for all this, but reading comprehension, you got 17th percentile. Like, what happened? And I mean, I didn't know what to say. I just said, well, I obviously can understand what I read because I did so well in the other sections. And yeah, I think it was just a fluke. So she kind of looked at me like, this guy. My thoughts on pediatric dentistry. Leanna, you have to be a special person to want to be a pediatric dentist. You couldn't pay me enough to be a pediatric, to deal with kids all day. Pediatric dentistry is, you have to be a special person. You have to be, the dental work is not difficult. It's the easiest dental work you'll do. It's all it is managing the patient, managing the child. So that is the difficult part. And if you're good with kids, awesome. I mean, I see kids in my practice, you know, I like have the Netflix queued up. I have like cartoons queued up, and you tell show do you have to be kind of goofy, you know, you show them, like, you call a suction, you know, Mr. Slurpee's coming, and you know, with the drill is, you call, oh, it's, you know, we're gonna clean the sugar bugs out, we're gonna put the tooth to sleep, and you got to be real goofy. But if you like kids, do it. In terms of compensation, I think pediatric dentistry is one of the lowest compensations. So if you love kids so much to go to school for extra 3 years and make less than the other specialists, then you should do it. What if they cry? Oh, let me go back to that one. So the first office I worked for, they would strap kids down on the papoose board. If you Google what a papoose board is, man, it was bad. And they would just be losing it. They would like wow out on the chair, and man, it's tough. It's tough working on kids. And if they're crying, you still got to work, because you know what, you got to get it done. And mentor was like, well, if they cry, their mouth's open, so it makes it easier for you. I'm like, damn, dude, this guy has no heart. So my other buddy that went to Texas, he worked on kids all day, and I don't know. I mean, he's always a talker, but he said he was going to therapy because he could hear the kid's belly screams like in his sleep. So that was like, it's not for me, man. That's not for me. Because they would sedate him too with midazolam. So yeah, Sona, if you can do it, or was that Sona's question for pediatric? No, Leanna, do it, girl. They need you. They don't need me. What are some of the things that we can do over the summer you're doing gap year to make your application look stronger? Cotty and I feel like at all dental schools just want, to see, I care about the community outreach. They're not going to want you to put down like, I don't know, I want an office in Beverly Hills where I do veneers all day. So that's so on your application, I think if you go volunteer shadow, I mean, I think everyone kind of does that. I think it's really difficult to separate yourself on your application. I think it was hard when I was going, and I think it's even harder when you guys are applying. But yeah, I mean, I think you do dentistry related things. I think that there are mission trips you can volunteer for, like going to different countries and helping with patient care. I feel like that would look really good. What else? Yeah, being in a dental office. I don't know, maybe even getting, I mean, some people would say like x-ray license, some people would say like a coronal polishing license, basically polishing teeth to be able to do that. It's kind of showing that you're already like taking initiative and getting in it. Yeah. I wish I had the magic bullet for you cutting, but I don't. I feel like I got in with this with the skin of my teeth. So um Mary, how are the courses you take after dental school, like additional cosmetic dentistry? The courses after dental school are very, basically the more money you pay, the more inspiring courses and the higher level you get. I loved going to those courses. I don't do as many now because in all honesty, I feel like I don't get that many new tidbits, and the courses can range from like a good course can range from like $5,000 to $17,000. So it gets up there pretty quick. But I did that because I wanted to learn all that. And you can take courses from kind of the gurus in dentistry. And if you ever, like, once you get in it and you hear those names, they're like the dental gods, and they'll show you cases, and that'll just make you feel like, man, how did these guys do this stuff? But then one day you start looking at your own cases and you're like, damn, I'm pretty good too. Part-time, part-time at a daycare. Nice, Mary. Okay. Advice on paying loans. My advice is don't get them. Try to do the armed forces, try to do scholarship. Because that's what I was kind of saying, alluding to in terms of reverse engineer your life. What does your budget look like? What do you need to make? A $600,000 loan is probably about $6,000 a month, and if it's a 10-year payback, that's what you get when you're coming out of school, out of dental school. It's a 10-year payback. You can refinance it to 30 years, which makes it more manageable. I was on IBR because I couldn't afford to do like the full amount. IBR was income-based repayment. That's like 10% of your paycheck. So I think that, I don't know what it is now, but probably a starting out dentist. I had this conversation with Kylie, who's in here, but starting out dentist makes, let's say, 180K a year, right? 180K is $15,000 a month. You're gonna pay loan, you're gonna pay taxes on it. After taxes, you're at, let's say, 9,500 clean in your pocket. So how much is your rent? Is it $3,000? So you're gonna knock that down to 6,500. Let's say your car payment. What do you want to drive? Are you driving a Kia? Are you driving a BMW? Or are you what are you driving? So let's say your car is $500 payment, insurance $200 a month, um, gas. So you can get up, let's say $800 a month on the average. It can be cheaper, it could be more. So take that down. So to where were we at? 5,500, let's say, 5,500 bucks a month left over from gas and house. And what do you spend on month for food? You spend 2,000 bucks. You go out, you eat at restaurants, you're going to be a dentist, you're going to be working, you're going to want to go out. So, you're not left with a lot. Like I said, 600K in loans is 6,000 a month. So somehow the math isn't going to make sense. The math won't make sense for a while. I started paying mine. I got lucky. My parents came into some money. They helped me out. I paid them back. But it had to be like that's another reason why I started a practice, is because at some point you need to you're in a lot of debt and you need to make more money, and you're not going to do it as an associate unless you find the dream associate job. Because showing up to work every day and not having all the headaches of staff, HR, let's say marketing, all that stuff, it's nicer not to have it, but you might have to take it on and to be able to pay those loans. So that's why I'm saying, if you do armed forces, you're done in 4 years. I mean, that's amazing. So, I mean, that's kind of what I was alluding to in terms of reverse engineer your life. Think about, what things cost, what you need to make, because, as much as you have to love dentistry, you have to be compensated for it. Were there Armenians in my class? There were Armenians there was one Armenian in my class, and he has an office off Sunset Boulevard in WeHo, I think. Yeah. His name's Oshin. But dental school's very special because you'll form, especially if you're leaving, you'll form your own little family, probably like you guys do here at UCI. If you moved away from home, you form a little family, and it's pretty special because you guys are going through the same thing. You guys have your off time at the same time. So, we'd get done with exams and we'd all go out, just probably like you guys do. But somehow dental school is just, undergrad on steroids. All right. You go to conferences from Sona. Conferences, honestly, I'm not the conference guy. I would just take the continuing education classes of like what I want to know. Conferences are also good because you might get deals on like dental equipment. But I don't know, I just never clicked for me. I don't like walking around with my little name badge and walking up to tables and seeing what's up and asking people for things or trying to get a deal on something. I don't know. It was just never was for me. But a lot of people go. A lot of people love them. All right, I think I made it through. Did I forget any questions? Did you do research in undergrad? Yeah, I did. I worked in anti-aging lab. I basically just fed the fruit flies, but that was a big GPA boost. That was probably like the biggest cheat code to boost my GPA. So yeah, do that. I think it was Rose, his name is. I don't know if he's still there. He basically engineered these fruit flies to last like 3 times their lifespan, and everyone all over the country would buy these fruit flies to do research on them, and he made millions and millions and millions of dollars for UCI. No personal question here. I'll be open. I'm completely open with you guys. Would I recommend kids or dentistry to my kids? I don't know. They have to love it. And I think that's for you guys too. You gotta love it because there's easier ways to make money. I think that, dentistry is crazy because you'll always have, with dentistry, you're always going to have a 6-figure income, right? I mean, well, if you work enough. So you're very safe in terms of having shelter, having food, being able to afford things. If your goal is to crush it and be on a private jet and own a yacht, you're gonna have to do a lot in dentistry to get there. I mean, I'd say go the financial planner route and skim 2% off of everyone's portfolio. So there's just there's easier ways to make money. So if you don't love dentistry and you're not ready to deal with patients that are unhappy, or you're not ready to deal with insurance companies, which is the big monster in the room, then don't do it. You gotta love, you have to love being able to make the difference in people's lives, in terms of whatever route you go. Christine, do you make the food for the fruit flies? Do you mix it all up in the mix up the food and unload it? Thanks, Christine. Any other questions? Personal statements lie. I don't know. Use ChatGPT. I'm kidding. Personal statements. It goes back to you gotta play the game, and you gotta talk about community outreach, and you gotta come in with a bleeding heart. I mean, you have to. Thoughts on the tooth fairy? It's real. I have a patient that she's one of my special patients. She would bring us lotto tickets. She still brings us lotto tickets every time she comes in for the whole office. And then she also keeps talking about how she printed these tooth fairy cards, golden tooth fairy cards, that she's the tooth fairy, and she would give it to patients that were good. She used to own a dental lab like 40 years ago. So she's hung up on that. But you get some, I call her one of my strays. So in life, you'll pick up some strays that you feel bad for, and you always try to help them. And so, yeah, she's one of my strays. Anything else? No problem, guys. Yeah, absolutely. I don't give out lollipops after procedures. I do have coffee in my office, and enough people are like, oh, trying to make business. Lollipop, trying to make business for yourself. Like, I didn't put the cavities there, all right? You put the cavities there. Yeah, so you guys can have my email. I don't know if I type it in. I'm not a Zoom guy. Sorry, guys. This is before my generation. I didn't have to Zoom while you guys are all in COVID.
I think there's no more questions in the chat. Thank you so much for providing your email. I'm sure that will come in handy for our pre-dental students who may have like questions popping up. But I think I can speak on behalf of everyone when I say thank you so much for this presentation once again. Very informative. We heard a lot of different, like from all avenues of dentistry that people could possibly be interested in. So I want to thank you again. You're getting a lot of thank yous in the chat.
Yeah, no problems.
Thank
No
you so
problem. Reach out if you guys think of something else. I'm here. Oh yeah, sure. I don't know. Can you email them, Ingrid?
Yes, I can.
Just so that it's not in the chat. I feel like
Yeah.
it's tough.
I can definitely send that out to if you guys. I'm not sure if you guys have joined our group me, but it's in the link is in the Armenian Pre-Health Instagram bio. There's a link tree, and for UCI's chapter, there should be a link to our group me. So if you guys, I'll send Dr. Kabaklian's email to the group me, so you guys can have access to it. But it is in the chat. I will.
Thank you so much. Have a great night.
Thanks, guys.
Thank you so much.
Thank you. Thank you guys for joining. Bye, everyone. Of course, Julie. Thank you so much for coming.
Yay, thank you, Inga.
Of course. Okay, I'm gonna end the meeting now.